First, I want to welcome everybody on behalf of everybody at the Scleroderma Foundation, Greater Chicago chapter. Thanks for joining us tonight. I'm Stephanie Summers-Gresh. I'm the Executive Director for the Greater Chicago chapter. I know you all have a lot of questions regarding COVID-19 and what's going on in our communities right now. So the purpose of this evening is to try and answer as many of those questions as possible. And we're really fortunate to have some of the leading experts on scleroderma with us tonight to help guide us. And so I want to give a huge thank you to all of our panelists tonight who've taken time out of their really busy schedules to be here and help us get some answers and information. So we really appreciate that. Tonight's webinar will be recorded and I'll make it available on our YouTube channel afterwards. So we'll put a link up on our website for that at scleroderma.org/GC chapter. And for any of you participants out there that are new to the Scleroderma Foundation, our website's also a great place to find out information on other resources that we offer, like support groups. It's where our medical and scientific advisory board posts updates on a regular basis regarding COVID-19. So it's a great resource for information in general. So that's scleroderma.org. And for our chapter, do /GC chapter. Thank you all again for being here tonight. And with that, I will turn things over to Dr. John Varga.
Good evening, everyone. My name is John Varga. I'm the director of the Northwestern Scleroderma program. And we've been fortunate to collect a panel of experts, physicians from Northwestern Medical Center, each of whom are experts in various aspects of scleroderma, and they are here tonight to help answer some of the questions you might have. The COVID epidemic, I think everyone is quite familiar with by now. It's changed our lives and it's posed a lot of previously unanticipated issues. Many of these are very specific for people with scleroderma, relating to their risk of getting the infection, management, what medications to take, what medications to discontinue, and many, many questions. And we thought this forum might be very helpful to try to address these. As Stephanie mentioned, the Scleroderma Foundation National Chapter, national website has up-to-date statements that are put together by the Scientific and Medical Advisory Board of the Scleroderma Foundation. But it's important to keep in mind that these statements really evolve over time as we learn more about the disease and its management. So we're very fortunate to have, to my right is Dr. John Flaherty, a professor of infectious diseases at Northwestern, Dr. Jane DiMatti, a professor of pulmonary medicine and an expert in scleroderma at Northwestern, Professor Dr. Brenner, who also has extensive experience, particularly in the gastrointestinal complications of scleroderma, and Dr. Chase Correa, a colleague and also a co-director of the Northwestern Scleroderma program. And each of these doctors are very actively involved in the care of patients with scleroderma and now various aspects of COVID. So they'll do their very best to answer your questions, but you have to keep in mind that this is a very fast evolving story. And for some of the questions we have good ideas and guesses, but not necessarily definitive information. So we'll try to give you the best reasonable information that we have. So with that, what I'll do is I'll read out some of the questions that we've gotten in, and I'll call on our colleagues to try to address these and tell you what their opinions are. So we had a question, for people with scleroderma, is it recommended to wear a mask? If so, what kind? And are there places to find these available to those who are more vulnerable, since there's a national shortage? And I thought Dr. Flaherty, the infectious disease expert, might take a first crack at this.
Okay, thank you, John. Good evening, everyone. Glad to be with you here. The mask issue has been evolving fairly significantly over the past few weeks. There are really, you might say, three types of masks. One would be a cloth mask or a scarf, which provides very modest protection. Then there would be the surgical mask, which is usually made out of paper. And That offers some level of protection. It sort of reminds you not to touch your face, your nose and mouth. And if you are infected, or if somebody around you is infected and wearing one of those masks and they cough or sneeze, that will tend to collect the droplets there and prevent transmission of these droplets. And then the most kind of, I guess, serious mask is the so-called N95 mask. You've probably heard of those. Those are what it tends to be in short supply in hospitals. And those, they're called N95s because they block the transmission of 95% of very small particles. That is less than 0.3 microns. So really tiny little droplets. Healthcare providers really need the N95s in certain settings. But even we are using the surgical masks in the hospital to protect ourselves and protect from each other and from our patients. I think the CDC is going to recommend universal masks for everyone. I mean, we've adopted it in the hospital, but I believe they're going to move forward in that and recommend that everybody who's in contact with other people at the present time be wearing these masks if you can get a hold of them. It would be the surgical masks, not the N95 masks.
And where do you, for example, people in the Chicago area, where might they, or what might be a good strategy to obtain these? I know there's a lot of stuff on the internet on how to make your own even.
Right. I mean, your best bet now would be to see if you could, I think, purchase it on Amazon, as they become available. These are pretty inexpensive to make, and I think a lot of companies are switching over to start manufacturing these now. I can't tell you what the availability is like. And in the meantime, you could make your own cloth mask, even with a scarf.
Thank you, Dr. DiMatti. Your microphone.
Yeah. So, John, I want to ask you: the purpose of wearing a mask, however, is that to protect you from somebody else, or is that to protect others from the asymptomatic person who doesn't know they have it, who by wearing a mask can protect others from getting infected?
So it serves two roles. So yes, it will protect you to some extent from droplet nuclei that might be, coughed or sneezed or sprayed in your direction in someone who's very close to you. And it will protect you if you touch a surface that's contaminated with coronavirus and then reach up and touch your nose or mouth. You'll hit the mask. But as you suggest, I think maybe the more important thing is that if you happen to be infected and don't know it, when you cough or sneeze, then that will collect those droplets and limit your posing a risk to other people.
To follow up on that question in a similar vein, there's a lot of interest in this. Is it safe to use an elevator that is used by others, even if riding alone? Can corona aerosolize and remain in the air in a shared common place like a condo? A lot of our patients live in high rises. So this is for somebody who has scleroderma.
This is a very controversial issue. There's some scientific data to suggest that in the appropriate conditions that this virus can be aerosolized and remain suspended for, maybe 1, 2, 3 hours. When you look though at the pattern of spread, it doesn't seem to be an important mechanism by which this is transmitted. Most of the transmission can be accounted for by close personal contact, and which would be more droplet nuclei or contaminated surfaces. It does survive well on surfaces, on stainless steel, for example. And so it is an issue. If you're outside, if you're pushing your way through doors, doorknobs, if you're pressing buttons, that those could be contaminated with virus, and which is why it's so important not to touch your face, nose, and why it's important to wash your hands when you come back home. And if by chance you happen to pick up some virus on your fingertips, that you'll wash that off.
Thank you, and we'll come back to that because I keep getting more questions. But to switch gears a little bit, this is for Dr. DiMatti. are there things we can do now that would minimize complications of COVID if we do get them? And related to that, how can we help our body best be prepared for COVID-19? So somebody who's either got an underlying autoimmune disease and or is on an immunosuppressive medicine, is there anything they can do other than trying to protect themselves from the infection to fortify their body to better cope once they do get infected?
So in terms of what one can do, and this, goes for everyone, staying healthy. So make sure you're eating right, make sure you're getting enough sleep, and try to do those things that just in general will help your immune system stay healthy. Exercise when it's safe. And again, that's difficult for people who live in a city or, as you point out, high rise. If you have somewhere in your own home where you can exercise, even if that's just going up and down the stairs or something within your own home. But do all of those things generally to keep yourself healthy. One of the questions I've had from a number of my patients is, should I be stopping my immunosuppressive drugs if you're on them? And our answer has been, no, you should really not. It's more important to have your disease well controlled if you do get sick than to stop those immunosuppressive drugs. First of all, most of them are not gone from your body, the day after you take them, the effects. And second of all, having uncontrolled disease, whether it's asthma or scleroderma, is far worse if you get sick, because then you already have other organ systems that are potentially not working up to their max. So our current recommendations is not to stop any of your autoimmune drugs, certainly not without speaking with your physician, and just to maintain general health. But I do think that all of our patients who do have autoimmune disease need to be hyper vigilant about all of the things that Dr. Flaherty talked about. Hand hygiene, so important. If you touch anything, wash your hands. Anything that is in the public space, certainly wash your hands. Hand sanitizers, if you're out for a long time, use a hand sanitizer to try to be sure that you are not carrying the virus around on your hands. And then just remember not to touch your face. But we all do that all the time without even thinking about it. It's easier, I think, said than done.
Right, so hand hygiene is a critical part of it.
Right.
A question from someone who has scleroderma and apparently is doing well except for reflux. What she's asking is, would it be helpful if I just allowed my reflux to develop or continue? Would that actually help to clear the virus and help me not get COVID from the viral infection? Dr. Brenner, do you think that's a good approach?
Unmute.
Doing this a lot. Can you hear me now? Okay. I'd say no. We absolutely want you to continue to take your acid blockers and protect your lungs. Like Dr. Damati just mentioned, the best way, if God forbid, you contract COVID, to try to fight it is to go into it healthy, and allowing that reflux or that acid to get into your lungs and to scar your lungs or to lead to inflammation is going to just be detrimental in the long run. So if you have acid reflux, you're taking the medications, and the acid reflux is controlled on your current medical regimen, keep taking it. That being said, when we're talking about prophylaxis, if you're taking acid reflux medications and you're not getting good response to those therapies, whether it's me or another gastrointestinal doctor, please contact us. We certainly want to do everything we can at this point to minimize acid exposure into the pulmonary system, especially as it relates to COVID-19.
And pulmonary acid exposure itself can be quite harmful, so we would want to minimize that. Right. A question regarding treatment that I'll ask for Dr. Correa. I have read that Actemra has some treatment possibilities for corona, for lung therapy. So for those of us who are already on Actemra, could this be of a potential benefit for corona? Dr. Correa?
Hi, thanks for having me. I'm here, happy to speak with everyone. Generally speaking, the benefits for tocilizumab or Actemra is for a very particular situation that can happen late in the disease called cytokine storm. And cytokine storm is basically where there is a tremendous amount of inflammation in the body as a result of coronavirus that is wreaking havoc. And that is what is thought to be the role for Actemra in coronavirus. It is not something that we are doing in advance of someone catching the virus. There are a few of you out there I know who are on tocilizumab or Actemra for their disease, and you can absolutely remain on your Actemra, but it's not something that we're switching folks over to. The fact is that it is not common, even if you catch coronavirus, to develop the cytokine storm.
And I think it's worth pointing out that immunomodulatory drugs play a complex role. They might potentially make you more susceptible to disease early on, but they actually could be potentially helpful later on. And there are clinical trials to assess it, and we just don't really have the answer. So as Dr. Correa mentioned, for now, we strongly recommend for patients to stay on their immunosuppressive drugs unless they are ill or showing signs of COVID, in which case they really should discuss with their physician what the right decision would be. Another question for Dr. Flaherty. Given the at-risk categories I meet, and this is not uncommon for scleroderma patients, interstitial lung disease, immunosuppressive drugs, age, so these three factors, but no symptoms of COVID. Am I eligible for COVID-19, and should I get it from Northwestern? What do you say to this situation, John?
So the testing has been a huge challenge. Our lab has been working night and day to ramp up testing capacity to be able to test. And we have ramped up considerably, but we're still nowhere near where we need to be able to test everybody that we would like to test. There is, so I can tell you that right now, testing for outpatients is very limited. If people are sick and they come to our emergency department or get admitted to the hospital, we have testing available. But for outpatients, it's actually the testing is so limited that if you call the COVID hotline at the hospital, which is 312-47-COVID, 47 COVID, you can talk to somebody there about whether you should come in and be tested. And by and large now, if you're symptomatic but don't require hospital care, then they put you on a list where they're going to call you 2 or 3 times a day to see how you're doing, and then have you come in if you get so ill that they think you need to be in the hospital. But otherwise, we don't have the capacity to test people. This is a huge problem. And I hope it's something that over the subsequent weeks, we can ramp up our testing further to be able to accommodate testing more often. But right now, I would say we're not recommending anyone get tested unless you're sick. And then you should call that 312-47-COVID hotline, and they can give you further instructions on whether you qualify for testing and then where to go.
Thank you. So 312-47-COVID is the Northwestern hotline for any issues related to COVID. Another question that maybe John or Jane could take is, if your spouse, so a scleroderma patient's spouse, is an essential worker, in other words, has to go to work every day, what special precautions should you as someone living with scleroderma take to try to minimize your risk?
Well, that's an excellent question. And Jane and I were chatting about that before we started the session today. My wife and I have talked about it, and I go home and we kind of carry on our life as before. At the first hint that I was sick, then I would stay away from her. But maybe, I know other essential workers are making other decisions. They're living apart from their families. They're using a different bedroom, different bathroom. Maybe Jane wants to comment.
Yeah, being working with a lot of these patients, there's a lot of concern of our healthcare workers going home to presumably healthy families and making different decisions, as John mentioned. Some isolating even without symptoms because of the concern of asymptomatic spread, others not. So and clearly now you're talking about your spouse coming home to you as a potentially immunocompromised patient with lung disease. So we've done a couple of things. Our office has sent letters in a situation where somebody could work at home, that it wasn't essential for them to be at a job. We have asked for them to be allowed to work from home. So we've tried to support that whenever possible. But when it's not possible, we've just made recommendations that when somebody does come home, that person's smart when they're away. If they're working in an office setting, they have lunch in their office. They don't go to a cafeteria where they're going to be around a lot of other people. So just that they practice very safe things so that they're not increasing the risk of their own infection and bringing it home. And when they do come home, they're just very careful that they wash their hands. And, if there's any symptoms at all, that they then quarantine within the home, somewhere where they won't be around their immunocompromised spouse. But it's a difficult question.
Right. Jane, another question for you. Having no diagnosis of PH yet, I'm a scleroderma patient with CREST symptoms on simvastatin, nifedipine, Nexium, sildenafil as needed. So perhaps somebody at high risk for pulmonary hypertension or pulmonary hypertension, but presumably no lung disease per se. With no pre-existing lung issue other than this, how serious could coronavirus be for me? So somebody who has primarily mild pulmonary hypertension in the setting of scleroderma.
So I think the risk is probably higher than somebody who doesn't have scleroderma, but I don't think the risk is very high. As a matter of fact, of the patients we're seeing now, we've actually not seen a lot of patients who have autoimmune disease. The risk factors seem to be associated with other things, with obesity, with hypertension being two large risk factors. Obviously somebody who has having chemotherapy, who is really severely immunosuppressed, is also at increased risk. But so far, our patients thus far have fared fairly well. And in this situation, without any lung disease and not on immunosuppressant drugs, I think the risk is likely, close to that of the general population.
Thank you, and that's very reassuring. So, we think that people at scleroderma are at risk population and certainly with lung disease, but yet, as Dr. Dimadi is saying, we have fortunately not seen a huge increase in people with scleroderma developing corona or severe complications. So that's reassuring. Dr. Correa, I have a question here. I've heard that testing hydroxychloroquine and chloroquine as a possible treatment for corona. For those of us who are already taking that medication, does this provide any added protection or benefit in this setting?
I think that generally speaking, those who are already on Plaquenil or hydroxychloroquine don't have any additional benefit that we know of so far in terms of reducing the chance of catching coronavirus. It is true that there are now a couple of very small studies that have shown some benefit to hydroxychloroquine in those who become hospitalized with the virus. However, there are some conflicting studies as well. It's also true that the dose that is used in those patients is higher than we typically use in patients with autoimmune diseases. So the bottom line is that you absolutely still need to take the social distancing and hand washing guidelines seriously, even if you're on Plaquenil, because we're not aware of any benefit to being on anti-rheumatic doses of hydroxychloroquine.
So you hear an awful lot about Plaquenil and this class of drugs in the media, but I think it's very important to keep in mind that the studies to date have been very preliminary and non-randomized trials. And the concept that, well, let's take this drug because at least it will do no harm is probably not a wise strategy, because this drug can do harm. And given that there is very little evidence, it should really only be used in a hospital setting, as we're doing at Northwestern for very ill patients, or in clinical trials. Additionally, if too many people with no indications take it on the presumptive idea that it may prevent it, we end up with a national shortage such that people who really do need this drug for their lupus, for example, can't get it. And that's a very dangerous situation. Okay.
John?
Yeah.
This is John. So I would just add, we've looked at those studies and as part of our infectious disease division and find them very unconvincing. As you say, it's very preliminary data. We've been allowing treatment with hydroxychloroquine in patients who are hospitalized at Northwestern with COVID. But I must say, I have not been overly impressed with the response there. A number of those patients have then gotten worse and ended up in the ICU. So it's certainly not a wonder drug, and we really need more information before we know what role it's going to play.
Thank you. And it highlights the importance that, especially in this day and age, you see a lot of pseudoscientific recommendations on the internet, but really important to check with your doctor to make sure that we use the best available medical evidence and a careful balancing of risk and benefit to decide which medicine you should be on. Okay, there's a question perhaps for Dr. Brenner. Does elderberry syrup help the immune system for this virus in scleroderma? I don't know if, Darren, you have any thoughts on that?
I would say at this point, we don't have any data. Just like, we know a lot of people are interested in using more holistic, natural types of therapies to treat illnesses. I don't think there's any evidence to suggest that elderberry is going to be beneficial in this situation.
Okay. Here's a question. I think it's relevant for all of us. What should I do if I catch the virus? So somebody with scleroderma obviously could be mild or severe or advanced, but what should somebody living with scleroderma do if they do have classic manifestations of COVID-19? What's the right approach? Jane, you want to start, maybe take a crack at this?
Sure. First, as John mentioned, don't just show up at the emergency room hoping you're going to be tested, because you don't want to be amongst many people if you don't need to be, and you're not guaranteed to be tested. So, for the Northwestern number, if you're in this vicinity and use Northwestern, call the 312-47 COVID line and see if it's appropriate to be tested. If they're not going to test you, if they tell you you don't need to be tested, stay home. They will call you and follow up on symptoms. If things get worse, you're breathing, you get more short of breath, you'll call back. Things may then change, and they may recommend you come in. They're not telling you, when you call them, just because they don't test you they're not telling you they don't think you have the virus and you don't need to worry, just that at this point you don't meet the criteria where they would want to test you. So monitor your symptoms. Watch your blood pressure. If you have lung disease, you probably have that pulse oximetry at home already. Check your oxygen levels, make sure they're okay. Just monitor yourself as best you can. When you do call, make sure they know that you have lung disease and that you are potentially on immunosuppressive agents. If you are, just make sure you give them a complete history when you talk, so that they will tell you when it's appropriate time to be testing. And if you have, always be prepared to give them information about your fever. How high is it? oxygen levels. If you do have a pulse ox and you normally run 95% and now you're 88%, I'm pretty sure that's going to make a difference in what they tell you to do. So if you suspect you have it, you have symptoms consistent with it, whether you call our Northwestern number or a number associated with any other university or public health care system, just make sure you have that number ready to call with your questions. I don't know, John, would you say anything different?
No, I concur exactly. I think, first of all, there's no proven treatment for this. So our care is largely supportive. So if somebody needs oxygen, we want you in the hospital so we can give you oxygen. And if you need oxygen, we want to keep an eye on you to see if it gets worse. Maybe, you would, require a ventilator, worst case scenario. And so those are the folks that we really want in the hospital so we can keep an eye on them. But if you're, if you just have flu-like symptoms and you're otherwise reasonably comfortable, even if you have fever and cough and you feel lousy, there's really not much, unfortunately, that we can do for you right now. So we'd say stay at home, but keep in touch with your healthcare provider or with the Northwestern COVID hotline, and then we'll let you know when to come in.
Thank you. And I don't know if you want to comment on the current Northwestern protocol where patients who are, I guess, seen in the emergency room, they get daily follow-up calls using a standardized protocol from the physician. Is that? Yes. There's
a whole team of people. They've actually enlisted, they have nurses, nurse practitioners, medical students, doctors. And so everybody who's on that watch list will get a call 2 or 3 times a day asking about their status and just keeping a close eye on you. And that doesn't preclude you from, if you feel terrible, just coming into the emergency room. But the idea is that we want to be proactive and trying to help people get through this. And the majority of people do get through this. So most people that have COVID are going to be fine. They're going to have a flu-like illness and they're going to recover completely in a week or 2.
Thank you. A question again regarding hygiene. Is it wise to wipe down groceries before we bring them inside our homes? So if you go shopping, what's the proper protocol to minimize risk of contagion in the home?
That's a tough question. The virus doesn't survive very well on cardboard. We know it tested cardboard. So while it survives pretty well on stainless steel, which is why I think when you go to the grocery store, grab one of the wipes and wipe off, the handle on the cart. That would make sense. I think it's not going to survive usually very well on packaging, but if necessary, yeah, when you get it home, take it to the extent that you can, take it out of the packaging and throw the packaging away and then wash your hands. If it's, boxes and things like that, it's not going to survive a long time on a box. So, you just put stuff away, the virus will not last on a cardboard or paper material.
Thank you. This is a question maybe for Dr. Brenner. Any thoughts on Advil, naproxen, and NSAIDs? There was some early concern that these drugs perhaps could be promoting viral proliferation and making the disease worse, but those have been called in question. Can you comment on those?
I haven't seen any literature of late suggesting that was going to increase your risk of viral transmission or viral infection. Certainly, to echo Dr. Flaherty and Dr. Damati, if you're home and you're being monitored in your febrile, we're certainly going to recommend these anti-fever types of therapies as needed to keep your fevers in check. But also be aware that, at least from the GI standpoint, in the GI literature, up to 1/3 of people that are seeing GI symptoms are never experiencing fevers. So it's not the only marker or indicator that we want to keep our eye on when it comes to these symptoms. Certainly the respiratory symptoms are obvious, the fevers like we're discussing, shortness of breath, sore throat, cough, but also keep an eye on gastrointestinal symptoms. We're seeing people presenting with nausea, vomiting, and diarrhea as presenting symptoms as well.
Okay. So there has been a lot of stuff in the lay literature, primarily on NSAIDs, particularly ibuprofen. But again, the scientific evidence that it really has a clinical negative impact is very weak or non-existent at this point. So while the usual recommendations about using these class of drugs in people with reflux applies, there's no strong evidence that they would make the virus or the risk of infection worse at this point. Okay, Dr. Correa, this is specifically a question for you. My dad has been exposed to the virus through his work. He shows symptoms such as cough and sore throat. He is not isolating himself from me. What are the odds of me having scleroderma or getting COVID-19? So again, it's someone who lives with his parents and he thinks that his dad very possibly has COVID, and what would be optimal measures to take? Or anyone else can also join in.
Yeah, I would say this actually comes to be very similar to what we were discussing as healthcare providers, where we are all at risk for coming down with COVID-19. Now, unfortunately, your dad may in fact have the virus if he's experiencing symptoms that are consistent. Just as we all discussed that if we became infected with the virus, we would probably have some contingency plans where we do our best to, at a minimum, isolate ourselves from our family and our loved ones within our own homes. And so for me, that would be that I would sleep in the guest room, that I would do my best to prepare my own foods and really avoid all the common areas of the house to my greatest extent possible. And I would also be wearing a mask if I myself came down with the virus, and I would encourage my whole family to as well. The exact odds of you getting it, I cannot say. Unfortunately, the closer the exposure, meaning the more time you spend sharing the same air, is unfortunately a risk factor and a fairly significant one for catching COVID-19. So you do want to minimize that if possible.
I would just add to that, it is, as I agree, Dr. Correa, it's a very high risk. The least preliminary estimates are that it's more than 80% attack rate in the home if you take no precautions to prevent transmission.
I've heard a lot about ventilation and having good ventilation or even open windows. To what extent can that be protective by reducing the viral load in the air particles?
That does help. So, I mean, we utilize that in the hospital with air exchanges in rooms. We have if you go to resource limited settings where they have a lot of tuberculosis, the tuberculosis wards are really the ones where they open the windows and leave them open. So that does help. It will dilute down and eliminate, or at least dilute the risk of transmission. Unfortunately, it's been very cold. If it would warm up, that would be a more practical approach.
Right. Now, this is a question, again, I think it goes back to some of what we talked about earlier. Is there a difference between a surgical mask and a dust protector mask? Jane, do you want to take that? Unmute your microphone, please.
Yeah. So this may be a better question for John. Part of the issue is I'm not sure what you mean by a dust protector mask. Any mask that sort of prevents droplets from entering the air around you and then depositing on a surface is going to help you from spreading the infection to other people. But I'm not sure what a dust mask is. John, do you know?
I think, well, dust masks, I think it's some, people that work in grain silos or people that work in lumber mills, that sort of thing. When you're doing construction and and there's a lot of, dust being generated, they're really a version of like an N95. So it's right to really filter out very, very small particles. So a dust mask is going to be more effective than a surgical mask.
But it's important to remember again that while in an ideal world, everyone maybe would wear those, there is a national shortage. And it's very important that the maximal protection be available to the healthcare workers who are the by far highest risk, such as respiratory therapists and intensive care doctors, because they do potentially get exposed to very, very high levels of the virus. So N95 is primarily at this point in that setting.
I would add to that that if you wear an N95 mask properly, it's hard to breathe. Because you really suck the air through this thing. I mean, we are fit tested at the hospital for these, and it has to fit really tight. And really, I can only last about 10 minutes with one of those on before I start to get lightheaded. So it's another reason why we wouldn't really recommend it for routine use.
Thank you. A question, how severe is the shortage of hydroxychloroquine? So again, the discussion about Plaquenil and its use, it's only indicated for a few diseases, and COVID is certainly not one of those, but because of the extensive media coverage, it's been very, very widely used. Dr. Correa, do you want to address that if you can?
Yeah, so unfortunately, there is definitely a shortage of hydroxychloroquine. And as Dr. Varga mentioned, there's other rheumatologic diseases, such as lupus especially, and rheumatoid arthritis, that definitely need hydroxychloroquine to keep those diseases at bay. And coming off of those medicines puts those patients at a particularly high risk for flare. So we really do want to reserve the Plaquenil for those who need it. Unfortunately, for patients who are newly starting Plaquenil, for example, a new patient who just got diagnosed with lupus, the current policy at many of the pharmacies is that they are limited to a 15-day supply, which is in hopes that the supply shortage will be fixed within those 14 days. That is supposedly getting better at the major pharmacies because thankfully Plaquenil is not the most difficult medicine to make. However, it's definitely something that we want to reserve for those who need it.
Thank you. The question, I don't know who might have the answer. Are there data available on how many scleroderma patients across the nation or the world who have contracted COVID-19 and what their outcome has been? In my looking at various chat rooms and emerging online registries that are being set up around the world, I have not seen any particular mention of people with scleroderma, and that's somewhat reassuring to us because it seems to indicate that despite their being immunocompromised and despite having lung disease, people with scleroderma may not be at an extraordinarily high risk of either getting this or getting severe complications. So somewhat reassuring, but of course, we still don't have a lot of data in this regard.
I did reach out to someone who has started a global registry of patients who follow with rheumatologists who have contracted COVID-19. And there's only 2 patients so far. And so far they have relatively stable but hospitalized courses. This registry would tend to collect patients who were hospitalized with the disease. And the other thing that I would say is that, yes, hopefully the relatively few number of cases does mean that perhaps scleroderma is not a major risk factor. I also think from talking to a lot of you out there and many of the folks who have submitted some questions here, I've been very impressed with how diligent all of our patients have been in really following the CDC guidelines well. And so I do think that you guys deserve a lot of the credit in there being such a low infection rate so far among scleroderma patients.
So that's a little bit reassuring and good to know, but obviously we'll keep an eye on it. And as Dr. Correa mentioned, there's a number of registries being organized really around the world in real time to monitor the frequency and the complications. Another question, again, maybe for Dr. Correa or Dr. Dimari, during the peak time of this virus, how should I go about getting blood work done? I was wondering if there are labs that might come to a patient's office to try to avoid being exposed in a clinical laboratory or medical office.
I would say that this is definitely the time to discuss the lab work with your physician. There are many different ways in which we order labs. There are some of you who have been on very stable doses of all of your medicines for years and have never had any problems with liver function tests or kidney function tests. And it might be possible that in conjunction with talking with your physician that you might be able to delay those tests a little bit, not a lot, not many, many months, but perhaps 1 or 2 months safely. For those of you who are getting labs done because you just spoke or just saw your physician and there's something new or concerning that would potentially change your management, those labs are probably more important and probably need to be done. I did specifically ask a patient today how busy the lab was when they went, and they said that there was not a single person at the Northwestern lab today. So in the circumstances where those labs are urgent and important, then thankfully, the message is out. Folks are taking social distancing seriously and for the most part are avoiding the hospital, which is a risk factor for getting the disease. So if you absolutely need to get those labs done, I do think thankfully there's lots of precautions in place and the lab is not very busy.
So Chase, if I can add in, because I have a parent who needs regular labs due to an illness, they're doing a good job. If you're out in the satellites or the suburbs, specifically the Glen, if you need those labs drawn, they're being done on a more urgent or emergent type of basis. And because of social distancing, it's really asked that the physician contact the lab and they're making pre-scheduled appointments. So they do have later in the day hours that are open and people can access the labs, but in many instances, people are having to make appointments to come in and have their labs drawn.
Right, and a lot of places like Quest also do labs by appointment. And so you can call and make an appointment so that you're in and out. And I think they're really trying to respect the fact that they don't want to have people sitting around their waiting rooms waiting for labs. But I also would have to agree definitely with what Chase said. I'm telling a lot of patients who've had stable labs to defer this month and maybe even next month. However, if there's a new medication you're on or your dose has been adjusted, there are cases where we just can't circumvent the need for the labs. But I think probably in well over half of my patients, I feel perfectly comfortable deferring on some of those labs, which also goes to be said for CAT scans and pulmonary function testing, and all of those tests should be deferred at this point.
Right, and I think our experience is so far that taking care of our people with scleroderma by telemedicine has actually been working fairly well. Obviously, there will be times when it's absolutely essential to have a face-to-face, but as much as possible, we're trying to do telemedicine for now. A question, my rheumatologist says corticosteroids should be avoided during the pandemic unless they're absolutely necessary. Do you agree with this recommendation? Dr. Dimari, maybe you want to, or Dr. Flaherty, take a crack at this?
Well, if you're, one thing I'll have to say, if you're on corticosteroids now, you certainly should not just stop them. This is not a drug that if you've been using it for a long time, you can abruptly stop without potentially doing yourself more harm than good. So I'll mention that corticosteroids, like a lot of the other medications people are on, are controlling disease. So as we said at the beginning, keeping your disease well controlled is important. So you should never stop a medication without consulting with your specific physician. If it's possible to go down and minimize the corticosteroid dose, by all means, that may be something that you and your physician together decide to do. However, you need to do it within consultation with your physician and absolutely never just stop this medication. John?
Yeah, I think
Anything else?
some of the concern was because I think in China, when the epidemic started, they didn't know how to treat these people, and so a lot of people got steroids, like high dose intravenous steroids, and those didn't seem to help. And so the data would suggest that high dose steroids don't help in the setting of severe coronavirus infection. But I agree completely with Dr. Damati that I mean, you should not stop on your own. And there's no evidence that stopping that is going to protect you if you're on a stable dose of steroid therapy.
And clearly there's a lot that we don't have a lot of data to back up, but we do generally feel that any medical or medication decision should be carefully weighed for every individual scenario and discussed with your doctor rather than following any kind of a blanket recommendation. A question, an interesting question, but not sure if we have an answer. What are your concerns about the idea that the virus will go away with the warmer weather, but come back in the fall, perhaps even stronger than now? Does anyone have any insight into that question?
There's some precedent for that, you know, with influenza. So the 1918 influenza, the 1957 influenza pandemic, even the H1N1, the 2009 influenza pandemic. We don't have that kind of experience with coronavirus. So we don't know if coronavirus will behave like that. I will say the gut instinct of most of the people that I talk to in the infectious disease world is that it will go away and it will probably come back. And it may go away and come back in a series of waves over the subsequent year or two or longer.
But really, we just don't know at this point. We can hope, but
right.
We don't really know what's going to happen.
Exactly.
Okay. A question for Dr. Correa. This is someone who had bad ischemic ulcers or ulcers on their fingers, but they're also very conscious about frequent hand washing. What do you recommend in that scenario?
Yeah, that's a tough one. Sometimes those ischemic ulcers can be particularly painful to wash with soap or to wash with any hand sanitizer. I think one option is if you have access to disposable gloves and those don't bother your hands too much, that may be an option, especially if you know that you're going to be preparing food or doing something that's a little bit more communal like that. I also think that for some folks with particularly severe disease, it may make sense to try to dip your hands in a paraffin wax bath for those of you who have it. Then wash it off and again, do what you need to do and then peel that wax off later. It's also, it may be possible to find methods of reducing that discomfort for those of you who only have pain when you also are having an attack or something like that. And you may be able to hover your hands over the water and get some benefit from the general warmth of the water before you wash your hands.
Thank you. Now, we talked a lot about self-quarantining. If you think you're high risk, you have lung disease, you have immune suppression. How long should somebody be self-quarantined? Our statement said 15 days, but clearly at 15 days, the pandemic has not gone away. Would you recommend people who are maybe at high risk to basically really go on a pretty rigorous self-quarantine for the duration, whatever that may be, or what do you recommend to patients? John, maybe you could have a crack at that.
Right, I think our evolving understanding of this is that this is not going to go away soon. And even when they talk about when it's going to peak, remember, the day after it peaks is the second most number of cases. So we may be in sort of a lockdown for a couple of months. And so people who are at highest risk should probably anticipate that they're going to have to really quarantine for at least, that long. and then we'll see how things develop.
Yeah, yes. Well, I think we're coming to the end of the hour. Hopefully we were able to address some of the questions. There's many other questions coming in. This will also be available. I know Dr. Dimadi wants to make another comment.
Yeah, there were just a couple of things I wanted to mention. One is, you know, when you call the COVID hotline, if you're told not to come in, I'm sure you're going to be anxious if you have fever and symptoms. One thing I wanted to point out is that this disease tends to progress relatively slowly. And that's the point. People will get back to you, check in on you. You'll be checking on yourself. It is pretty unusual that people have, you know, suddenly go from being well and oxygenating okay to being in tremendous distress. And so one, I just wanted to reassure people that they don't have to have that anxiety, that I think many will no matter what, but that there will be time to get to the hospital if need be. And then the second thing I wanted to point out is we've talked a lot about wearing masks. And, you know, I was out the other day and in a line at the grocery store, and we were all distancing, and there was a gentleman, a couple of people behind me, who had a mask on, and he spent the entire time online like this, touching his face and readjusting the mask on his face. And without offending him, I didn't know how to sort of tell him, you're doing yourself more harm than good with that mask. So just wanted to make those two, you know, point out those two things.
Thank you. And so exercising good hygiene and following the CDC guidelines is very important. And while we don't have a cure or very effective treatment for COVID, we're learning every week. We're developing strategies and new treatments. There are many clinical trials ongoing at Northwestern and really around the world. So I think every week we'll be a little better armed to deal with this pandemic. And we'll hope to do this info seminar again in the near future to address new concerns and share new information as it comes out. So I want to thank my colleagues on this panel and turn it back to Stephanie.
Thank you. I also want to echo that. I want to thank our panel of experts again. You guys go out of your way to make sure that we all stay informed, and we really appreciate it. So thank you guys for taking the time. Again, we're going to post the link to this recording on our website. So it'll be at scleroderma.org/GC chapter. We'll put a link to our YouTube channel, which is where we're going to post it. So again, scleroderma.org is a great place to just get updates from our medical and scientific advisory board, get connected with the local support group and other resources. So thank you all for attending tonight, and stay safe and be well, and we'll talk to you soon.